So in the case of bone and cartilage, there are many types of fractures, fissures, and defects that fail to heal. By using concentrated bone marrow stem cells injected into these defects, we can replicate and stimulate the natural process of bone healing, which requires migration of the bone marrow stem cells into the fractured defect to remodel and repair the bone. One unique thing that I do that helps optimize outcomes of stem cell therapies is to embed them and mix them with a scaffolding matrix. And when I do this, I mix the stem cells in, especially these mesenchymal stem cells that come from bone marrow, which are primed to become orthopedic tissues. I bind them into these hydrogel matrices, these protein matrices, which help to stick the stem cells right where I inject them. And that prevents the stem cells from diffusing and disintegrating and dying off and undergoing a process called anoikos, where stem cells will essentially just die off, similar to a programmed cell death of apoptosis. These stem cells, they want something to grab onto and to live and thrive on and proliferate on, and that helps integrate them into the tissues. So the fibrin scaffoldings are really good because they're like a sticky matrix that helps stick to tissues. It gives the tissues a matrix of growth factors itself. Plus, in addition, it holds the stem cells there to help bind them and localize them and integrate them into the injured tissues. Small and thin bones especially struggle with healing due to the lack of adequate marrow or adequate perfusion, particularly the scaphoid, sesamoid, paraspinal bone, and others. In some cases, this may also be used for necrotic bone defects, not due to an infection, but things like osteonecrosis and avascular necrosis, as pointed out in these studies.